You know, we've heard everybody's stories, and they're all different in terms of whether they had chemo first and then reconstruction, or whether they had the surgery, or whether they chose to have the breast removed. No two stories are really the same, are they?
Very correct. The algorithms for how we choose the most appropriate care for each individual cancer patient are very dependent upon not only the stage of the cancer, meaning the size of the primary lump, as well as the status of the lymph nodes, but also a lady in today's world drives her cancer care. So even though we may not mandate that from a cancer standpoint a mastectomy must be performed, we have many ladies in today's world who are opting to have mastectomy on the affected breast and a prophylactic mastectomy on the non-affected breast.
You know, it's interesting because, again, this goes back to where the support, having supportive people around you who understand all of this and helps you get through it, is probably one of the reasons more people are surviving, is it not? Yeah. How important was it for you, Kristen, to have somebody to talk to about this, or who could relate to what you're going through?
Well, for me, I mean, like I said, I was 36 when I was diagnosed, so it was a complete shock. And immediately a friend of mine contacted me and put me in contact with another woman that had it. She was my age, but had it a few years before me, and she was a godsend. And she answered questions that I didn't feel comfortable asking my doctors, but wanted the answers and all the tests and what's chemo like and what's radiation like. It's a very big comfort to talk to somebody that's been there before.
I would think that also selecting the right doctor would be a godsend as well.
Yes.
Did you find that for you?
Absolutely. I think my doctor, they both walk on water, and I'm sure you do also. I just haven't had the pleasure, and understand, I hope I don't.
And I don't take that personally.
But yeah, my doctors were fabulous.
And what kind of advice do you give to women who are saying, okay, now I have to make these decisions. How do I differentiate it all, and how do I pick the right people who are, you know, the right doctor for me? Do they ask you that kind of stuff?
Yes, they do. And we typically try not to give too much specific advice on which doctors to pick. One of the pieces of advice I give women is, it's first and foremost for you to be comfortable with your medical team. Right. And there are a lot of great doctors out there. And, you know, I tell people, if you feel like you want a second opinion, go for a second opinion. It's always a good idea.
In this day and age, too, you can always ask, because, boy, word of mouth goes around very quickly. We all know someone who's been affected by it, so if your doctor was good, ask. I have to take a quick break, but we are thinking pink here in Philadelphia, the home of our CN8 studios.
If you want to see more of this episode of It's Your Call, you can with Comcast On Demand. Using your Comcast cable, go to Channel 1, get local, CN8, and then choose It's Your Call, CN8. On air, online, and on demand.